when I put the needle in, I'm going to splash you a little bit, okay? I'm going to kind of trick you, and you're going to feel a little bit of a tickle.
Dr. Paul, I want to introduce you to a good friend of mine and an incredible doctor, Dr. Ryan Wood. Full disclosure, for those of you who are squeamish about needles, he's going to have a needle here, or maybe more than one. He is doing a stellate ganglion block. Now, what I'm going to describe here, just prepare yourself for what you're going to see. The needle goes in the neck, and there's a bunch of nerves in the neck that have to do with pain, perception, transmission of nervous impulses. And with this ultrasound guided block, he is having incredible success for conditions that are usually resistant or refractory to almost any other treatment. We're talking about PTSD, severe anxiety, and a whole host of things that you're going to be exposed to in this video. So this is going to be eye-opening for many, and the link to his information is in the description. Enjoy the show.
So I'm Ryan Wood. I'm the clinical director of Northwest Regenerative Orthopedics. We're an interventional regenerative orthopedic medicine specialty clinic, and we're about to do a stellate ganglion block on a patient who came in with some PTSD, anxiety, and who's also suffering from long COVID.
I'm here with Dr. Ryan, and I'm about to get my number 2 stellate block, stellate ganglion block for long COVID and all of crazy anxiety from my car accident. And I can't wait to see how it goes, and he's the best.
What's this?
What's up?
What's this?
That's my ultrasound machine. This is my Sonosite PX, Portable X. Sonosite's kind of like the Maserati of, or the Porsche, maybe the Ferrari of the ultrasound world.
Okay, okay.
I think most everybody has a little bit of just anxiety coming into these blocks. It's normal. When I get injections, I get anxiety as well. And it...
Really?
Oh, absolutely. And I've had tons and tons of injections. When you're putting needles in people, it's not an easy thing.
No.
It's not easy to do, and it's not easy for people to experience, right? But there are a lot of things that you can do to make the experience much more pleasant, like cracking jokes, popping
Popping a value.
a value, right?
Popping
No,
beads.
it's true. You
Right.
joked around the whole time.
Right, and that's my job. My job is to do my best to do it, make you as comfortable as possible, and at the same time perform the best care.
I agree, because if you were really stuffy and just
Oh, yeah,
boom,
I
boom,
can't
boom,
wear
I couldn't do it.
I can't wear a white coat. Those days are long gone.
I couldn't
Did you
do
see
it.
my shoes?
Memory and taste and smell. Taste, my God, I can taste things.
Yeah.
But memory, I remember now.
Good.
I didn't before.
Maybe I should go have another one of these.
Like no, I'm not kidding. I would literally, when I would leave the house, lock the front door, or I would, like an OCD person, go back twice to make sure. Close the garage door. You took the dog to the bath. Like stupid, everyday things. Crazy. I remember things, and I can do math in my head again now.
The whole experience is just to make sure that you're chill, you're relaxed, you're feeling good, and we get this done as good as we can. We try to make everything as sterile as we can, which means that, you know, this isn't surgical sterile level. We're not doing surgery on somebody. What we are trying to do a very clean aseptic technique. You know, so the way I describe it is, after a stellate block, it's like you've had a couple rips with Snoop Dogg,
Oh, no,
only
I look
on
like I
one
smoked a
half of
pound
your
of
face.
weed.
Can't help myself. Would you push the head unit back a little bit for me, Doc? So what we're gonna do is, I'm just going to, your neck's been scrubbed and it's clean. I'm gonna kind of tuck this in here just slightly, and what I'm gonna do is, oh, excuse me. So we're at the C6. We're at C6 right now, and that high part right there, that's the anterior uncinate, and also known as Chasniak's tubercle. And then longest coli, well, you can see a little bit of surgery in there, so you can see a little bit of that. But what we're trying to do is we're trying to aim for right in this fascial plane right down here between these two muscles. And that's typically where the stellate is going to live. And then as you get to C6, it transverses over and it attaches near the anterior uncinate. So the actual anatomy of where the stellate lives, the autonomic chain, it's actually difficult to find. But I think right here, this is about where I'm going to put the needle. I'm going to put the needle right there, and that's where it's at.
Now tell me why other places put you to sleep to do this, and why it's not good.
You know, I have no idea why they put people to sleep for a stellate block. It absolutely makes no sense to me.
Like Twilight kind of thing.
It doesn't make any sense. Like, the only thing I could think of is for anxiety in people. again, I've done literally 1,500 plus blocks. I have never put a single person to sleep. At most, I give somebody a 5 milligram Valium before the procedure and call it a day. And to be fair, I've never ever not had a patient get through this procedure without, with any significant issues whatsoever. I think it's the expectation of the practitioner. If you're like, oh, I'm going to put you to sleep because that's how we do it. Well, yeah, I guess that's your choice. I just don't see it as a necessary thing. Literally, it's just unnecessary. When I put the needle in, I'm going to splash you a little bit, okay? I'm going to kind of trick you, and you're going to feel a little bit of a tickle. You feel a little stream down your neck. You feel that? You feel the stream?
I do.
Okay, I'm going to pinch you. Good, that was it.
And that was a needle, and I barely felt it.
Right. I'm just going to kind of numb down a little bit here. Just numb things off. Just put a little bit of anesthetic in here and kind of numb it.
Right now, I feel a tiny bit of pressure.
Right, and that's just me putting a little anesthetic in here and just get right down to the fascia right there.
Oh, that I felt a little.
Got a little twinge right there. Good.
Okay, this one I feel a little bit different.
Do you? So just
don't like that.
Really?
Not bad, just different.
Just different. So we're just passing through the fascia. We're just about to get down to longus coli. Put a splash of medicine. I'm going to ask you, do you taste any metal? It tastes like a penny. You good?
No pennies in my mouth.
Perfect. So I'm right where I want to be. And we're just going to take our time and do this lower injection, okay? And this one is basically just sort of nice and slow. Make sure we're keeping the contents of this injection where we want it to be. We want to keep it right there. We want to keep it local. We want to try to get the fluid to flow up and down the fascial plane right here. And we're going to just do a little pumping action. And we do that just to try to get the capillary flow down the fascia. We see a lot of people that have, long COVID or feel that they've had, vaccine injury, or they have allergies and just reactions to certain drugs and medications. They might be more, like mast cell activation syndrome, POTS. These are other things that we see people get stellate blocks for. Postural orthostatic tachycardic syndrome is POTS, and the stellate blocks in general have the ability to really help these people out. And so we're just conscious and aware of what we're doing beyond just choosing a random anesthetic and throwing it in there. There's some thought behind that. So we take we try to think through every avenue and every aspect of our care.
Seeing it is the coolest thing.
Isn't it cool watching it?
I wasn't sure if I would get queasy because it's the needle going into my neck.
I get to play video games every day with needles.
Okay, that's a little sick, I'm not going to lie. You are one special doctor.
Oh, that's perfectly okay. It takes all kinds.
I agree.
So this right here is, we're just checking again, we're just using Doppler to look for blood flow. Typically in the upper cervical, there really isn't a whole lot up here we're too concerned about. This is a relatively safe injection. There's not a lot of communicating arteries or nerves, and you would think there is, but for this part of the injection, there's not a lot you have to avoid here, or not a lot that you're really concerned, hypervigilant about. It's usually just throw it in there, splash and go, and I don't know. But, we still just take our time. So, again, we're going to play the stand up the needle game, okay? You're going to feel a little bit of fluid dripping down your neck, and I'm going to pinch you. Pinch, pokey poke, and that's it. How was that?
Good.
Okay, one more. Pinch, pokey poke. Here you go. There it is. I'm going to set this in. I'm going to find it on my screen. Oop.
Oh, okay.
Okay, you ready? We're gonna go through the fascia, and this one is a little bit of a pinch. You ready?
Mm-hmm.
So 1, 2, 3, go. And we're in. You good?
Yep.
How was it? You okay?
Yeah, it just feels awkward.
Oh, you got a little hoarseness in your throat. I can hear that already.
Why does it feel awkward this time on this side?
I don't know.
Ooh, I just got a shock.
Did you?
Yeah.
What kind of shock? Like down your...
In my neck?
I'm going to say that I'm in the right spot then. So I'm not near any of your cervical nerves, but if you got one went down all your whole body.
Mm-mm. Just neck.
Just neck? Okay.
And it's weird. It's not pain. It's just an awkward...
Pressure.
Yep.
Yeah. It's unnatural. It's kind of like, what is that? I don't like that. No, it's not painful. It's just bizarre. Okay. We're done.
Woohoo!
You lived.
What?
All right. You lived. You survived.
Okay, now you got to tell me, is my face looking the way it's supposed to look? Does it?
Oh, yeah. I win. You know, this is a competition, correct?
What are we looking for, Doc?
So what we're looking for on Tiffany is for her eye to get red, the lid to droop, it to get puffy, and then eventually her nose to get stuffy, and maybe some sensation changes in her face, maybe some heat signs. So we measure 5 basic things for to show that we, win in terms of I got the block in the right place. And right now you can already, when she looks, you can already see how her eye is. You just relax.
Is it red?
Yeah, and see how it's less, you can see more of the white on this side than that side, how it's drooping.
Can you see yourself?
Yeah, but there's like a little dot over where my eye is.
Yeah, it's just tracking you.
Yeah. So it's already, I've already got her. She's already relaxed. That's the other thing you can tell because she's just sort of mellowing out. Although it could be the Valium, but the reality is that the Stellate block does actually.
Oh, I'm totally calm now.
Yeah, it makes.
Good job.
Oh, it was so funny. He looked at me and he's like, "Oh yeah, I got you good."
Oh, I got you good. That's
I'm
it.
laughing. I'm like, "What the hell?"
You know, it's a competition. I'm not gonna lie. Like, I enjoy my job, and when I do my job properly, and I get to see immediate results from it, I know, sweet, I did it. I did a good job. So, and it's rewarding. And then later on, people go, "Hey, I feel better." So at the end of the day, it's a win-win.
Win-win.